This video is general education only. It is not medical, legal, financial, insurance, or benefits advice. Always check Medicare.gov, healthcare.gov, your state Medicaid agency, or a qualified benefits counselor for your situation. If you are trying to figure out Medicare, Medicaid, and open enrollment, here is the first thing to know. These are not the same program, and the enrollment rules are not the same either. That one misunderstanding can cause people to miss deadlines, pick the wrong plan, or assume they cannot get help when they actually might have options. So let's make a simple money map. Medicare is usually tied to age or disability. Many people first become eligible around age 65, and Medicare has specific enrollment periods. Medicaid is based on state rules, income, household situation, disability, pregnancy, age, and other eligibility factors. Medicaid is run by states, and Medicaid and CHIP can generally be applied for any time of year. That means when someone says open enrollment, you have to ask, open enrollment for what? For Medicare, the big annual window is October 15th through December 7th. During Medicare Open Enrollment, people with Medicare can review their coverage and make certain changes for the next year. In many cases, changes made during this window start January 1st. This is when people may compare Medicare Advantage plans, drug plans, provider networks, formularies, premiums, deductibles, copays, and out-of-pocket limits. Now here is the second Medicare window many people do not understand. Medicare Advantage Open Enrollment runs January 1st through March 31st, but it is not for everyone. It is generally for people who are already in a Medicare Advantage plan. During that window, they may be able to switch to another Medicare Advantage plan or go back to original Medicare. So October through December is the big yearly review window. January through March is more limited.
Now let's talk about Medicaid. Medicaid does not work like a regular annual open enrollment season for everyone. You can apply for Medicaid or CHIP any time of year. If you apply through the marketplace and it looks like someone in your household may qualify, your information can be sent to your state Medicaid agency and the state will follow up about enrollment. But Medicaid is state-specific, so the details matter. Your state may look at income, household size, pregnancy, disability, age, whether you are caring for children, and whether your state expanded Medicaid. For some people, Medicaid may help with healthcare coverage directly. For some people who have Medicare, Medicaid may also help with certain Medicare costs if they qualify. This is sometimes called being dual eligible, meaning a person has both Medicare and Medicaid. If that sounds like you or someone you care for, do not guess. Ask your state Medicaid office, your state health insurance assistance program, or a benefits counselor what programs may apply. Here is the open enrollment checklist I would use. First, write down which program you are dealing with: Medicare, Medicaid, marketplace coverage, employer coverage, or more than one at the same time. Second, write down the deadline. For Medicare Open Enrollment, remember October 15th through December 7th. For Medicaid and CHIP, remember that applications can generally happen any time of year, but state rules and renewal deadlines still matter. Third, make a medication list, provider list, and hospital list before comparing plans. Fourth, do not rely only on the premium. Check networks, drug coverage, copays, deductibles, maximum out-of-pocket costs, referrals, prior authorization, and whether the plan works where you live. Fifth, save every letter. Open enrollment letters, renewal notices, plan notices, Medicaid notices, and Social Security letters can all matter. Sixth, if you are helping a parent or relative, create one folder for their insurance cards, plan letters, medication list, doctor list, login information, and call notes. And seventh, get help before the deadline. Medicare.gov, 1-800-Medicare, your state Medicaid agency, and your local state health insurance assistance program can be better starting points than guessing from ads. The big takeaway is this: Medicare has windows. Medicaid has eligibility rules. Marketplace plans have their own open enrollment, and a person can sometimes be dealing with more than one system at the same time. Do not wait until a bill arrives to understand which coverage you have. Make the map before the deadline. Subscribe to the Healthcare Money Map for plain English guides to the healthcare paperwork that affects your wallet.